Good morning, good afternoon, good evening, wherever you are. I'm making my coffee. We have a lot to talk about. It's been a couple of days. Also, I love my creamer. I'm mixing two of them. I am mixing vanilla bean and hazelnut. Don't judge me. I love a lot of cream. Okay. Anyway, we have a lot to talk about. There's so much stuff coming up with Sebastian. It's very exciting. It's a very exciting time. That first sip of coffee just hits so good, doesn't it? It's so good, I'm gonna take a second sip. Thank you. Good morning, good afternoon, good evening, wherever you are. We are now coming on the 6-month checkpoint after Sebastian's heart surgery. So he has so many follow-ups coming up. In addition to that, he has a few surgeries coming up. Nothing big, but surgery is still surgery. There still has to be a recovery time. In addition to that, we are getting ready for Sebastian to start school this fall. So it's really hard because timing of things. I'm trying to plan where Sebastian can just enjoy being a kid this summer and not have to recover from anything. But I also want to have him get the surgeries he needs and have enough time to recover to be able to be successful in school, if that makes sense. So Sebastian's most recent or soonest follow-up is actually today. He's just following up with his pediatrician. It's like a 6-month post-surgery / 5-year checkup. They're gonna weigh him, which we could do at home, but we don't weigh him often. We just don't. So whenever he goes to the pediatrician, which isn't often unless he's sick, I really enjoy seeing how much he has grown, and I think he has grown a lot. I'm so curious to see how tall he is and how much he weighs, because I swear I feel like every single day he's grown out of his clothes and his jammies. So he does have a follow-up today. And then in about 2 weeks, I think, he has a follow-up with cardiology to see how his heart is doing after surgery. He also has a follow-up with neurology. I think that's just a conversation. I don't think he's gonna get any scans or anything done. Sometimes yearly, he'll have an EEG to see how his brain is doing. But I believe that this follow-up coming up is just to make sure that the medication that he's on that's controlling his seizures is still working well for him, to check in if he's had any more seizures, which, praise the Lord, knock on wood, he has not had any seizures, I want to say in almost a year. So this dose of seizure medication that he's on Keppra, it's chef's kiss. It's in a very sweet spot. He's managing seizures very well. And I think that's it for follow-ups. I feel like pediatrician, cardiology, neurology, and I think that's it. Moving on to surgeries. I don't know that I have ever mentioned this to anybody on this channel because it's a little more personal, and it shouldn't be. It's just our bodies. It's very common, I think, in the special needs community, but also fairly common specifically in the CDLS community for boys. I don't want to say for sure, so please don't quote me. Don't quote the Bible on me. But I know of a few other CDLS males who were born with their testicles ascended, I believe. They're still up. They haven't come down yet. Sebastian was born that way, and he has needed to have that surgery. But again, for the last 5 years, it has been all about his heart. All about his heart and getting his heart right before we can really work on anything else in his body. And now that his heart is gorgeous, we have to start moving on to other surgeries that we have been putting off that weren't high priority, but still a priority. The biggest risk of not dropping the testicles is it raises a higher chance of testicular cancer. We don't want anything extra. So Sebastian, and I believe it's an outpatient procedure. I believe it's laparoscopically. I don't want to get too much into the details, but it's very simple. They go in, make 2 little cuts, they pull them down, and that's it. So Sebastian has to have that surgery. I haven't spoken to any other CDLS moms. I know of a few whose child had to have that surgery, and I believe the recovery was pretty easy, but I haven't spoken to them in depth, which I plan on doing. I just want to know what to expect, especially because Sebastian can't tell me if he's in pain. I stress. I believe that that is the first surgery that will be coming up. That will be the first thing that we need to get done, because Sebastian, he's 5 years old. He's going to be 6 this fall. This is something that we need to take care of like this year, just to prevent anything. We just got to get that done. And then Sebastian does have a follow-up with his eye doctor, but in addition to that, it's a double follow-up. He has a follow-up with an eye doctor for his vision, but then we also have a follow-up with his oculoplastic surgeon to discuss doing another correction on his left eyelid. He had eyelid surgery. He has a condition called ptosis. It's basically just droopy eyelids. Typical children and people can be born with ptosis or develop ptosis over time. But he's had droopy eyelids, both of them. He had a correction on both of them a couple years ago. I think he was 2 or 3, and the left one rejected. He ended up getting a staph infection in his eyelid, and it rejected. That is also a surgery that he has coming up. That surgery is not a priority, but we do believe we saw a big difference in Sebastian when he had more use of his vision. We don't know exactly what he can see. We know that he can see, but we also know that his vision is limited. So we don't know exactly what he can see, but having that eyelid all the way up and being able to actually see fully from both of his eyes, we believe is beneficial to him. So although this surgery isn't a requirement, it's probably something that he would be okay without. We also just feel like, why wouldn't we do it if it's a simple surgery and something that could potentially benefit his quality of life? So those 2 surgeries are coming up this year. We're just looking into a lot of different therapy things for Sebastian. We have been discussing researching a chiropractor or a torticollis specialist for his neck. We have been researching Botox injections for his neck as well as his arm to relax the muscles in his arm, his right arm. Somebody did ask a question the other day if we were ever going to do anything about fixing Sebastian's clavicle and his use of his right arm. And unfortunately, there's nothing we could do for that specifically. Like when he was born, he had a broken clavicle on the right side, but he was so sick. We were just trying to keep him alive and really for a clavicle, the only thing you can do is like put it in a position and let it set and let it heal. And however it healed, doesn't sound right. The way that it healed is in a position where he just has limitation on how high he can lift that shoulder, but we are working with him like every single day, lifting and stretching and trying to get more use of that arm, but definitely open to certain therapies if they're safe and beneficial for him. I think a lot of you would be happy to know that I have been recently looking into aqua therapy for Sebastian. As you all know, he loves the water. I've seen so many people comment on here and I never replied really because I haven't had the chance to look into it yet, but I have been looking into it. There is aqua therapy in our area and I think that is something Sebastian would really love, and I'm going to try to get him in. I feel like that's it for the updates. Sebastian just burped in the background. I feel like that's it though. It feels, I guess the other thing I was going to talk about is we are working on getting him his IEP, getting everything ready for school. We have to do that this week. There's also some stuff going on with his insurance that I don't really want to get into. It's not a big secret or anything. It's just very stressful and I don't have any information on it. Sebastian's on a program through his state how do I put it into words? Offers him benefits for his needs, and they do redeterminations for that. And that's always just stressful. So we're kind of going through that. Everything's going to be fine, but insurance is always a pain in the you-know-what. Before anybody gets confused, by benefits, what I mean is therapy services and help paying for his medications and his feeding supplies and stuff like that. We don't get paid to be Sebastian's mom or dad. So before anybody that's new here hears the word benefits and thinks that we are getting paid to take care of Sebastian, we're not. Just wanted to clear that up. What I mean by benefits is like services, therapies, all of that kind of stuff. So anyway, insurance is always just a pain in the butt. So we have all these follow-ups, and then in the middle of all of that, we're kind of like working with insurance, and then on top of that, trying to get Sebastian into school. So there's a lot of stuff going on behind the scenes that I've just been too busy to be able to sit down and update you guys on. That was a lot. Got this song stuck in my head. You know, you call me out upon the waters, the great unknown, my feet may fail. Okay. Do you guys want to say hi to Sebastian? Cheers. Thanks for spending my coffee time with me. Thanks. You know what I mean. I'm tired. I picked Gio's parents up from the airport. We didn't get home until like 2:30 last night. And Sebastian got up at 6. I'm tired. This will not be my only pot of coffee this morning. All right, let's go say hi to Sebastian. I'm done. Good morning. Hi. Hi. Good morning. I love you. Hi. Wow, someone's got a lot to say. Good morning, beautiful. What you doing over here? I just gave everybody a big update on ya. What you think about all that, huh? What you thinking about? You leaving me? I want to see you. Come over here. Come over by your mama. No. Look at how tall he is. Look at how tall you are. I can't wait to see how tall he really is. The last time we were at the doctor's office, or the last time that he got, what's the word? The last time they checked his height. Why can't I measure? The last time they measured him. Coffee has not kicked in yet. He was, I believe, 31 inches tall. So I'm excited to see how much bigger he's gotten in the last 6 months since surgery and how much he weighs now too. Right after surgery, he was 15 pounds. So we'll see the update on those numbers in a little bit. He's starting to do his kick flips. Show me the, yeah, you're getting excited. Show me. Can you come away from the, come here. Just come away from the fireplace, please, a little bit. Give me this tubie. Give me that tubie. Show me your kick flip. Do it again. Come on. Use those feet. Show me. Hey, you. I'm talking to you. Show me. I want to see how cool you are. Go on. He's so cute. He's not going to do it. Hey, mister. He's too concentrated on trying to get that tubie in between his legs. He just finished his morning feed and got his meds. I think he's going to take a power nap. I forgot to mention earlier that Sebastian also has a follow-up with ENT for his chronic ear infections. And I think he did have tubes at one point. We think that they're gone and they may place new tubes. Or if the ones that are in there are not doing what they should, they'll take them out and replace them. I'm not sure, but he does have a follow-up with ENT as well. He's still rolling around over here. What are you doing? Is that funny? What are you doing? Oh, also, just because I'm looking at his teeth, Sebastian, hey, that doesn't look like it feels great, dude. Sebastian also has a follow-up with the dentist before school. Yeah, he's been to the dentist before. Yeah, we gotta get your teeth cleaned. Gotta get those teeth cleaned. You're crazy. Little goofball. Oh, you're leaving me again. See you later. Bye. I guess somebody got super tired rolling around on the floor. He passed out on the couch over here. but I'm gonna let him take a nice little nap. He's got a doctor's appointment at 3:30. So I'm gonna sit here and enjoy a little bit of my book while he takes a nap. It's a perfect day for a nap. I don't know if you'll be able to tell. Hold on. It's kind of cloudy out, you can see. Don't mind the stickers in our windows from getting our windows replaced, but you can see it's kind of a cloudy day. It's kind of a little bit chillier too, so it's the perfect day for a little snooze. He looks so cute. Well, I guess the next time you guys see us, we'll be at the doctor's office. When Sebastian laid down for a nap, I laid down for a nap with him, and all of a sudden, it's 3 hours later. So we did end up missing Sebastian's doctor's appointment this afternoon. However, it's not a super big deal. It's just a follow-up that I scheduled last week. I scheduled it just because it's been 6 months since surgery, and I thought, it's probably a good time to just get a check-in. Whatever. So, again, not a big deal. I'll reschedule it for next week. The only thing that I would probably do today is weigh him and measure him and just ask us if we're doing well, which he is. So, a little embarrassing, but not a big deal. I'll reschedule it probably for next week sometime. It has been rough around here with Ninja. That one night that he woke up in the middle of the night, he got up out of our bed, me and Gio's bed, and he went into our bathroom, like I said, and he went poop and pee everywhere. It was everywhere. And it still smells like pee in there. I bought the floor 3 times. Regardless, anyway, prior to that night and the couple nights after that, I couldn't sleep because I know that he does that, and I couldn't sleep because I kept fearing that he was going to get out of bed and do that. And then last night, like I said, I got Gio's parents from the airport, and I didn't get home until like 2:30. It's just been a long couple of days. Him missing his pediatrician appointment, it's not a big deal. Like I said, I scheduled it. I will just reschedule it. He's still sleeping right now. I think he's been asleep for like 3 hours, so I'll probably wake him up. We'll see you in a couple minutes. Like, look how cute he is. I can't wake him up just so we could drive an hour to the pediatrician just so they could weigh him and measure him and ask us if he's doing okay. His pediatrician is friends with us on Facebook. He knows that he's doing okay. We'll see him next week. I think it's pretty safe to say that our entire day kind of got consumed in just resting. I know that I definitely needed to catch up on some sleep, but I did not think that Sebastian was going to take a 4-hour nap. At one point, I just kept checking, is he still sleeping? What's going on? I mean, I was down here the whole entire time, but I can't believe he slept that long, but I guess he needed it. Maybe he's growing. I don't doubt that he's growing. I am going to reschedule his appointment for next week, so sometime next week we'll find out how tall he is and how much he weighs. But for tonight, I don't know if I already said this, I'm still pretty sleepy. It's almost 5:45 and we still have to run to the pharmacy, so I think I'm going to cut the video here for today. I do have to nanny tomorrow. Tomorrow's my last day nannying that we had scheduled. So I don't know that I'll be able to record tomorrow, but I will definitely probably check in with you guys on Thursday and Friday. I'll get into a little bit more details of school, maybe do a therapy session with you guys. And Gio and I have been wanting to take Sebastian to the frozen yogurt place in town here. So I think we'll try to plan to do something fun with him on Friday, a sweet treat on Friday or Thursday or Friday. Per usual, thank you for being here. Thanks for checking in with us. And I will see you later in the comments, and we will see you later on this week sometime. Say goodbye, everybody. We'll see you soon. Yeah. Bye-bye. You're sleepy too. I get it. We'll see you guys soon.